Hello, and thank you for listening to this COVID-19 update as we approach the end of June and beginning of the 2022 summer. As we all return to a more normal-looking summer in Santa Barbara, it's a great time to review the remarkable journey we've had with this virus, as well as ask some important questions about what's likely ahead. And there's lots of good news to cover today. But just as Santa Barbara and Cottage Health have wisely and sensibly navigated the journey so far, it's very important for us to remember that ignoring this virus has never worked. What has worked has been information, education, communication, and so we're bringing you another short COVID-19 update. The goal will be to answer three important questions. We want to talk about whether or not COVID-19 is still here, whether COVID-19 is still a problem, and also cover what should we all know about COVID-19 as we begin this summer ahead. As I mentioned, in very good news, things are very different now than they've been for 2 years. The Omicron variant, which hit the world very hard, including, of course, here in December, January, and February, have been different than any other prior variants. Since Omicron arrived, we've seen the start of a new chapter of the pandemic. The Omicron variant was remarkably infectious. It spread through communities, we all remember, spreading through South Africa like wildfire. But then, quite quickly, what we saw happen was everyone who was going to catch it did. And then the waves passed. We can now look back on that Omicron data and learn a lot about how things have changed and help us to prepare ahead for what we may see, especially this summer. And not just good news, but perhaps great news. We're clearly seeing less severe disease than in the past. And in fact, most of the people in the hospital who have COVID are actually in the hospital today for other reasons. And they also have COVID. Many of us know many people who've had COVID in recent weeks or recent months. And while nobody wants to get COVID or feel unwell, many of us are seeing people recovering quickly, recovering well, getting back to their lives. There are, of course, less common examples where people unfortunately are still falling ill with severe COVID pneumonia or other serious complications like blood clots. But thankfully, this is happening less and less frequently than during the past surges. And so what does all this mean with regards to public health and public policy? It simply means that the threat of a severe COVID-19 surge, which cripples our healthcare system, has decreased substantially. And as we all remember, it was that concern that really drove so many of those initial drastic measures in 2020 and 2021. There is, of course, less good news to mention, and I want to be clear about some of that also during the next few minutes. We need to think about how infectious every one of these variants and then subvariants have become, and also understand how this virus is cleverly shifting to get around immunity that we may enjoy from a recent infection or perhaps even from prior vaccinations. All this to say, the virus has simply changed. COVID-19 has changed. We need to remember this when we look at graphs of cases over the past 2 years, when we hear about hospitalization rates, but also when we think about our summer ahead. I certainly empathize and actually feel very often the desire to simply move ahead, forget about COVID. But that approach leaves us vulnerable to disruption. Don't get me wrong, there are days that I truly wish I could wish away this virus. But what we're seeing play out is the virus is finding its way to being likely one of our usual coronavirus, one of our usual human coronaviruses. It may well cause 1 or 2 seasonal surges every year, hopefully with fewer and fewer severe complications in the months and years ahead. In the meantime, as we work through this stage, it's increasingly important that we not bury our heads in the sand, but rather inform ourselves and make sure that we're protected against the disruption this virus may bring us over the next couple of months. So then thinking about specific ways this virus has changed. Again, we know from personal anecdotes as well as media reports, and now more conclusive studies and data, that the Omicron variants do appear to cause less severe disease than in the past. In fact, most of the people in the hospital who have COVID this week are actually here, as I mentioned, for other reasons. As we know, people can still fall ill with severe COVID pneumonia or other serious complications, but the data we now have from these Omicron surges around the world are showing that this is happening less and less frequently than surges of the past couple of years. While a smaller proportion of COVID-19 patients in the hospital are there, indeed, because they have severe COVID-19, the fact that that proportion is getting smaller and smaller with these surges really does decrease the fear that a surge will devastate our healthcare infrastructure. And that's very, very good news. It's very good news, of course, for people as patients, but also for healthcare administration as we plan and continue to care for the community's general health needs. Another good news, the risk of long COVID seems to be changing with these new variants. Remember that in addition to the immediate impact that a COVID-19 surge used to have on hospital systems, it caused us to pause surgeries, sometimes repurpose an entire floor to care for COVID patients, often multiple floors. There were many other very, very tough operational decisions. It's the looming threat of long COVID that is now the shift of many who are considering the impact of healthcare infrastructure. Even when we stop seeing a lot of severe life-threatening COVID, many of us are still wondering and worrying about how much suffering and cost to the healthcare system we could see if waves like the massive winter Omicron surge continue to sweep through communities and continue to cause a very large number of those people to develop long complications, what we now call long COVID. There was some really important data released in the past couple of months by the CDC that looked at the cases from 2021 in the United States. The risk in that data set of people developing long COVID was as high as 1 out of every 5 people who had previously had COVID. In other words, if over 90% of a town caught a new infection when a new variant surge swept through, it was anticipated that as many as 1 out of every 5 of those people could potentially suffer from long-term symptoms of long COVID. The potential of this threat is very different than the threat of shutting down a hospital, having to pause surgeries. The potential of this threat is related to our long-term health as individuals and also as a community. And it's chilling when we think about how big this risk of long COVID could be to our well-being, our long-term health, and even the health of our workforce as we try to get back on our economic feet across so many sectors, healthcare included. And so what is the good news? Again, Omicron is different. Just released last week with some very reassuring and important news from the United Kingdom. That 1 in 5 risk of long COVID, it came from data in the United States before Omicron or its subvariants hit the stage. We now have a very important publication in The Lancet last week, which looked at the risk of long COVID in those during the initial Omicron surge, and the risk appears to be far less. It's perhaps closer to 1 in every 20 people who suffered from the Omicron infection, or maybe even 1 in every 25. And while we of course want to avoid any people developing long-term COVID and complications, this information is really good news, that the risk of long COVID with the current Omicron variants appears to be significantly less than with past variants. So then let's consider what is less good news right now. So unfortunately, no matter how much we wish it away or move forward with our lives, we are left with the disappointing news that COVID is still here. And as we just discussed, it has changed, but it is still unequivocally here. Then we face the really important question, the one I often consider myself, and very sincerely consider myself, why should we care? If COVID is causing less severe disease and likely far lower risk of long COVID than ever before, and the hospitals remain functioning, the world has kept turning, why does it matter to most of us if COVID is still with us? It matters because although we're not facing those same scary risks as we have over the past 2 years, we still have a lot of this virus circulating in our community with the potential to spread rapidly and really disrupt our lives. We talked about some of the positive changes that the newer variants appear to have brought, but in addition, the virus has become more and more infectious. In good news, we know that masks, especially indoors, make a huge difference in preventing the spread of this infection. But we also know that the virus is changing to become more and more infectious. While the risk of becoming infected outdoors is much less than indoors, unfortunately, there are even some examples recently where the virus has spread among people unmasked outdoors who were very close together for a longer period of time. So what does this mean? For me, it has not scared me into routinely wearing masks outdoors, and I still comfortably enter indoor public settings and stores, often without a mask on for just a few minutes. But when I'm going to spend a lot of time with people close together, I do feel more comfortable leaning on my mask, knowing how much COVID is in our community this week. If possible, I'd prefer not to spend several days suffering from those flu-like symptoms, and I really don't want this virus to disrupt my life. I don't want it to disrupt my family's life, my ability to work, my kids' ability to do their activities this summer, and our family's fun-filled adventures ahead, enjoying travel and the beautiful Santa Barbara area. For each of us to consider, whether it's considering a few days of suffering through symptoms, perhaps being one of those unlucky few people who are still developing long COVID, or perhaps considering missing work, school, camp, scramble for childcare, rescheduling the dentist appointment, having to cancel that trip you were planning for so long, be mindful that the virus is still with us. And if we keep that in mind, we're well armed to make sure that the plans remain intact. And so to finish with a look ahead at the summer and consider the question of if and how we in Santa Barbara may experience a summer surge. A pause here for gratitude to everyone who's been involved with tracking cases so closely for these past 2 years. This is the familiar graphic of the whole pandemic from the Santa Barbara County Community Dashboard and the Public Health Department. It's been a touchstone for me, I know, and for so many of us in the community as we work to make sense of the local epidemic, really since the beginning. But the landscape around this data has shifted. Measuring cases in the winter of 2020, for example, was so different than measuring them now in the summer of 2022. It really is comparing apples to oranges when we think about how few people who have COVID this week in Santa Barbara are actually getting a PCR test, which is then reported to the county and the state and ultimately showing up on this chart. We know that proportion, that percentage of all the cases that are showing up in this chart are far less than ever before. And so as this case rate data has changed and making it more challenging to truly and accurately understand how much infection we have in the community, we have other opportunities to look at objective measures, including the wastewater. For those of you who are not familiar with this, most infectious diseases, including the virus that causes COVID-19, are actually secreted in our stool when we have the infection. Even though it's a respiratory infection, some of the virus makes its way into our intestines and ends up in the toilet. And so when cases in a community go up, the amount of virus in the wastewater as a whole goes up. And similarly, when the number of people with COVID-19 decrease in a community or a city, there will simply be less virus ending up in the toilet and then in the wastewater. And as the cases go down, we see the wastewater virus also go down. It's actually a very sophisticated way to follow diseases because it's not influenced by how people are testing or how many people are testing or where they're testing. And so for this reasons, experts across the country, including here in Santa Barbara County, the city of Santa Barbara, UC Santa Barbara, and Cottage Health have started watching the wastewater very closely. On this graph, you see a concentration of two parts of the virus, simply called N1 and N2, in orange and blue respectively. And what we see here is the past year in the city of Santa Barbara's wastewater. You see early on, there were some what now look like small bumps from the Delta surge. And remember, that was late last summer. That was followed, of course, by that very, very large Omicron surge in the center of the graph. And that was right around the turn of this year. And then importantly, we see that COVID-19 has really been with us at a moderate level for the past 3 months, with a spring surge, which never really returned to a low level. And now in the past 3 weeks, we're seeing what the rest of the country and the state are also seeing, which is an uptick, an increase in cases beginning at the far right of this graph. And just to emphasize the point, I'm showing here the city of Santa Barbara wastewater data versus the case counts on the bottom. It's clear that during the Delta and initial Omicron surges, the wastewater concentration was a good reflection of case rates. Now, unfortunately, case rates mean something different. And we all know people who've tested at home, isolated, then recovered, but don't show up on these case counts. And that's okay. That's the guidance from our public health officials. We don't need every single person with COVID to show up on the case counts. But what we do need is a way to track this pandemic, this epidemic, and the current state of COVID more accurately over the weeks, months, and years ahead. And so these graphs, as we look at them, they simply remind us that wastewater will be an increasingly important thing to follow over the summer to make sure that we really understand how much disease is in our community. Thanks to all who have worked on the Wastewater Collaborative, and hopefully more to come publicly for many of us to follow this in the months ahead. And so one final piece of perhaps not so good news came out of the New England Journal of Medicine this week. As many of us are hopeful that a recent COVID-19 infection at least brings us a few months of immunity and protection through this summer, we're learning that this is probably not the case. Across the United States, there are 2 subvariants of Omicron called BA.4 and BA.5, which are taking over and will soon likely be the most common type of COVID-19 in the United States. Here you see on the right the CDC's nowcast, which shows the most recent weeks and how the COVID-19 cases across the United States break down. BA.4 and BA.5 are the green colors in the bottom here, which, as you see, for about the last 6 weeks have been marching up, and very likely will take over the majority of COVID cases across the United States. South Africa has actually already had, and maybe coming down from, a surge with these variants. And many people in South Africa who had an initial Omicron infection, unfortunately, did still catch an infection with these new variants. Just released on Wednesday this week was some lab data saying essentially the same thing in the New England Journal of Medicine. Scientists in Boston looked at how well the blood and antibodies from people who had an initial Omicron infection or who were vaccinated did against these new subvariants, BA.4 and BA.5. Unfortunately, the results weren't very good. Neither group showed the ability to neutralize BA.4 or BA.5 well. So what does all that mean? To me, it's simply a reminder that while there's a lot of good news out there right now with regards to the trends and the way that this pandemic is changing and shifting, we really are likely facing an ongoing or possibly increasing surge of COVID-19 in our community as we enter the summer. And the best way to avoid this from disrupting your life is simply to stay abreast of it, to learn more, keep an eye on the data, including the wastewater data, lean on masks, enjoy our beautiful outdoor spaces as much as possible. But don't be fooled, it's not gone. And so I'll finish with just a thank you. I thank you for listening, for staying informed, and I very sincerely wish everyone a safe and wonderful summer ahead.